Sahib is very affectionate. He's very loving. He loves to connect with people.
Loving is the word that comes to mind. You know, always telling us how much he loves us, and if we were to introduce him to anybody, he would come and give you a hug, shake your hand, ask you how you're doing. Just a loving kid, and you know, anybody who meets him will say that about him. Yeah. Sahib was born in 2007, and after he was born, it was discovered, you know, right away that there was some issues, and we had a battery of tests and discovered that he had a genetic condition called DeGeorge syndrome. And so this causes a myriad of issues, hundreds of different possible symptoms. When they did the testing of his heart, there was no pulmonary artery. It was discovered that the body had created these collateral arteries to do the work of the pulmonary arteries that he didn't have.
For the first 5 years of Sahib's life, we were in crisis mode most of the time. This is when Sahib was 2 months old. We wanted to get a family portrait. We didn't know what the outcome would be, so we wanted to ensure that we had some pictures of us as a family.
His first operation was at 3 months old.
Seeing Sahib lying in the recovery room with so many tubes, and oftentimes we couldn't pick him up, was brutal. It was something that no child should have to go through and no parent should have to witness.
The last heart operation down in the States was a huge success in terms of a cardiac point of view. Unfortunately, air got into his heart during the operation and then traveled up into his brain, which caused multiple strokes, which had different consequences. One of the most obvious is that he lost the use of his left arm.
Sahib's time at Sunny Hill was very effective. Sahib worked with some excellent therapists. Over time, over the course of probably about 2 weeks out of the total of 6, we were starting to see improvements. We saw that he was able to take some toy trains that he enjoyed playing with and open up his left hand and wrap his fingers and thumbs around those items. In physiotherapy, we saw that Sahib's coordination and balance started to improve fairly quickly. He was on the treadmill regularly, and by the end he was riding a tricycle where he was able to use his feet in a very coordinated way. He would be zipping down the hall, in fact, and ringing the bell and telling everybody to get out of the way.
You want to see somebody treating your child as if they were, you know, their own kids, you know, and that's just very comforting, you know, that ultimately that he's in good hands.
Sahib's very positive, and that's something that he's taught us, is how to look at things in a more positive light and not to get bogged down in the why is this happening and why us, because he doesn't do that. This life that he is living is normal to him. He doesn't know any differently, and through it, he just maintains such a pure heart and joy.
All of individuals and families and organizations that have donated funds, and you know that without their contribution, that, you know, families wouldn't have potentially the technology, the tools and resources available to help. So we're very grateful.
ਅਸੀਂ ਸਾਰੇ ਪਰਿਵਾਰ ਵੱਲੋਂ ਆਪ ਜੀ ਸਾਰਿਆਂ ਦਾ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ।